Practicing Knowledge Translation is a course designed for implementers and those supporting implementation in their organizations. We've created a comprehensive program aimed at building capacity of the course participants to support implementation of their own project and within their own institutions. The practice of KT is vital to moving evidence into practice. Without using active KT processes, evidence passively diffuses into practice in an average of 17 years. By practicing KT, this time frame can be shortened to 3 years. And implementation of evidence can happen more effectively to reach intended outcomes. Knowing how to practice KT means understanding evidence, the science of implementing evidence, and applying this to your own work to impact health outcomes. The core competencies of KT practice focus on skills related to program development, implementation, evaluation, sustainability, and stakeholder engagement. The Practicing KT course instructs participants on each of these competency areas across 4 modules. In the first module, we cover the KT basics, which includes foundational knowledge and skills such as understanding theories, models, and frameworks, performing needs assessments, and understanding levels of evidence. In Module 2, we work on developing an evidence-informed, theory-driven program, or ETP. An ETP is made up of 2 components: an intervention, for example a clinical practice guideline, and an implementation strategy. We will teach methods of selecting appropriate implementation strategies by identifying barriers and facilitators to behavior change and mapping them to a behavior change framework and theory. In Module 3, we plan for implementation, including how to form an implementation team, figuring out if the organization is ready to implement, and tailoring the ETP to the local context. Participants will create an implementation and sustainability plan using theory, frameworks, and models whenever possible. In Module 4, participants will work on monitoring implementation quality and evaluating outcomes. What makes practicing KT different from other courses is that most courses in Canada are designed with the needs of researchers in mind. Practicing KT centers on the needs of the implementer, individuals who will be implementing at the front line or who will be supporting frontline implementation. Practicing KT is one of the most comprehensive courses available on best practices in implementation in Canada. The 4 modules are covered across 12 online sessions and a 3-day in-person workshop. Throughout the course, participants engage in readings, presentations, group activities, and assignments, and are encouraged to apply the content directly to their own implementation project. In addition to these activities, participants will receive individualized coaching to help them problem solve, apply implementation principles, and plan for capacity building within their organization. The entire course was intentionally designed to take 6 months to complete, which gives participants the opportunity to absorb course content and learn how to apply and relate the content to their own projects. Currently, the course focuses primarily on implementation in a healthcare and public health context. If you work in these settings and will be planning to implement or support implementation on 1 or more projects, Practicing KT is designed for you. Participants should apply with the support of their organization. We recommend that organizations enroll 2 individuals to support each other throughout the course and afterwards. These implementers should be in a position to support internal capacity building at the organization once they've completed the course. Participants should have dedicated time to complete the course readings, presentations, activities, and assignments. And all participants need to have a specific project or multiple projects in mind so that the course content can be directly applicable to their work. Due to space constraints, we can only accept 20 participants to the Practicing KT course per course term. The next term starts in September 2015 and will be completed in February 2016. If you are interested in applying, please contact Shushmita Islam for an application form. Applications are due on July 31st and will be reviewed by the course developers to select participants. Practicing KT was developed by Dr. Sharon Straus, Dr. Julia Moore, and Ms. Sobia Khan at the Knowledge Translation Program, Shing Knowledge Institute, St. Michael's Hospital.